All right, so here we go. I am Yona Lunsky from the Azrieli Center here at CAMH, and I'm excited to be back with one of my favorite family doctors, Yolanda and Neil. You want to introduce
Hi.
yourself?
Hi, I'm Ullanda Niel. I'm a family doctor. I see patients with intellectual disabilities at my community health center in Scarborough and also at Participation House in Markham. And I'm happy to be here.
Yeah, this is
This
our
is my third time doing this. So I'm rolling through the season. So now I'm trying to get a little more of a fall motif.
yes. Yes, we need to have like some autumn leaves behind us, you know. But it is an important time for us to be coming back, I think, to some questions that might be the same questions, although the science and the information we have now is a little different, as well as some new emerging questions, I think, as we have our emerging Delta and our, emerging very vaccinated population, things opening back up, what it means, all kinds of issues, I think, that people with disabilities and families want to know about. So I'll interview you, but sometimes you can interview me, and let's interrupt each other as we go and try to get to the bottom of some tricky questions for people. All right. When reviewing questions that came from different families, there's still, I will say, certainly in Ontario, because I've been able to look at those data really closely, the majority, many people with developmental disabilities have had their first and their second vaccine, which is fantastic. And we figured out really innovative ways to help people who've been afraid of needles, who've been afraid of side effects, ways to help people get their vaccine safely. But there are still some people who have not been vaccinated. And we did get some questions from families, people are still afraid in some situations. For example, what happens if my son or my daughter can't talk about the side effects that they'd be experiencing from the vaccine? How would I know, if something was wrong? I'm really afraid that something could go wrong and I wouldn't be able to pick it up.
For me, that's one of the first questions I ask when I have a new patient in my practice is, how do you know if your loved one has pain or has discomfort? And sometimes people don't know, and there's no answer. And sometimes they say, well, they might not eat as much, or they become more quiet. If there's any kind of signals like that after having the vaccine, it's possible that they could be experiencing some of the side effects that everyone else experienced. Some people have pain in the site of the vaccination, right? So thinking about pain in the arm there, or fever, which is something that you can test without having to really communicate about it, or headache, kind of flu-like symptoms. So I think it's reasonable to check for fever and to give something like acetaminophen for the pain or fever to see if it helps. And if you're not sure, then connect with your family doctor or primary care and see if they can help you tease it apart further.
But it sounds like that conversation is a really good step before the vaccine, so you kind of know what to look for and things to do. And if you gave someone Tylenol and it wasn't really a big fever, they didn't really need it so much.
Okay, yeah, and it's not going to affect the vaccine. At first, there was some concern about, can we use these medications? It's fine, you can use it, and it doesn't affect like the vaccine will still be effective. And the other thing is that over the time they've been monitoring and found like a small risk of inflammation around the heart. And so a side effect that you would see for that would be shortness of breath, chest pain. And so maybe it'll be hard to maybe pick up on the chest pain, but you might notice shortness of breath, or just someone looking a little bit unwell. And so again, you can talk to your family doctor about that. It's a really low risk, and it so far they've been monitoring it with the mRNA vaccines for especially males under the age of 40.
Right. So again, maybe having the conversation before getting the vaccine, so you have that open line with your family doctor if there's something you're worried about. So you have a plan and you know what to do. Like, when is it important to call the doctor? When is it important to go to a hospital? Right.
Right.
So just knowing in advance what to look for. There's two other questions that have come up around the vaccine that I think really scare some people with disabilities or families. One is allergies. What about an allergic reaction? People who are afraid if I get the vaccine, I'm going to have a reaction. So it's better for me not to get the vaccine. What do you suggest?
So far, it seems like it's very specific and rare allergies that would preclude you from receiving the vaccine. And so for the most part, if you have an allergy like that, you would need to be connected with an allergist, so a specialist, to confirm that. So if you have even just severe allergies to other medications or other things that are not specifically related to the vaccine, there's no evidence that you can't take it. If you discuss it with your family doctor and you are really concerned, they might be able to make that referral for you, and then you can confirm whether it's safe to take the vaccine or not.
Yeah, and I guess the other thing is that when you talk to the allergist, it's not so much, yes, it's safe, no, it's not safe. It's let's think about how to make it safe for you in most cases, right? So it's again that level of kind of planning and problem solving that's really important in those conversations. Another fear, we know that epilepsy is more common for people with developmental disabilities, and sometimes fever, can bring that on. So people are afraid if their loved one has a lot of seizures, maybe they want to hold back on getting the vaccine because they're afraid of the seizures. So what do you say when families talk about that?
Right now, I'm saying to consider treating the fever. So instead of avoiding the vaccine, be prepared to treat fever. So using something like acetaminophen, for example, because if you think about it, getting COVID-19 and having fevers and illness associated with that is also very bad for seizures, right? And so if we want to really protect our loved ones, we have to think about getting the vaccine.
Yeah, it's a really important point. Even stepping back, I think most of what I'm hearing right now, and what we've heard from families, has to do with some of these fears. I guess the other fear is just people who are petrified of needles and people who are really scared of any kind of blood work, anyone touching their body, right? So they might say, well, vaccines are all well and good, but this would really freak out my loved one. So we're just gonna not do it right now because who's gonna help us with that?
I think that's going to be a point where you're looking for a really accessible situation to get the vaccine, right? So you might know better how to make that happen. It might require a little bit of distraction or using a different site for the vaccine, like instead of being in the vaccine clinic, being in your car or at home. So you're going to have to start seeking out some of those alternative options, which thankfully have been provided in a lot of places, but not everywhere. So starting to advocate for that, looking for it is the key. And it's not going to work for everybody. It's true. I recognize that, but I do think that it's worth a try, right? Yeah. Also having the conversation, like being able to prepare. Sometimes we underestimate how much people with disabilities might understand about vaccines or needles or preparing to go to the doctor, but having the conversation is important, right? And it helps a person prepare themselves emotionally for the situation.
Yeah, one thing I've told families, it isn't actually just one vaccine. We're looking at 2 for a full dose, and there's going to come a time where we're going to be getting boosters. So we really want to help everyone have a better experience of having needles. And I think it's something we've avoided for some people for a long time, and COVID's kind of a lesson for us that we can't avoid that. So thinking about ways to help people be prepared and make sure the experience is a good one, so that we can, have it happen again as well. And we really are learning a lot because so many people are getting the vaccine about ways to help make it happen. So really reaching out. We have some great resources, which we'll include. And there's a lot of really good campaigns and supports. I think at the beginning, people wanted to get so many people vaccinated so quickly we weren't taking the time we needed to make sure we could accommodate everyone. But now that most people have had their vaccine, there is that time and space and flexibility and wisdom, that we didn't have at the start.
Right. Yeah, and there is the will for accommodation. I do see that in the vaccine clinics, at least in our area, that even if it's not focused on people with intellectual disabilities, they're really open and wanting to make it a place that is safe.
Yeah. I wonder if we can step back. There's one other set of questions that came up around the vaccine. I think people still kind of wonder, for a good reason sometimes, not sort of having the trust in this whole process, how it happened so quickly, this kind of experimenting that happened, and that can happen more to certain groups than others. I wonder, what do you talk about when you're having a conversation with someone who just is concerned about the sort of the rigor of the testing and the research that's happened that's making them sort of afraid or hesitant?
I do think when I look at how the vaccine came about, I think that it was studied in the normal way that vaccines are studied, so using clinical trials before it was released. The approval process for example, for Canada was a little bit faster, but that's because they pulled together the professionals and they amended things slightly to make it come out a bit quicker. But I think we can be more confident even by looking at the real life data of all the people that have received the vaccine so far. Like I even wrote down the numbers. 28 million people in Canada have received a dose of the COVID-19 vaccine. And worldwide, that's 5.8 billion people have received a dose of COVID-19 vaccine. So that's a lot of people to start getting data from and to understand what's happening with the vaccine. And there is a method of reporting side effects, and it's being recorded and carefully followed by public health in Canada. So I feel confident about the vaccine, all of the different formulations. The thing that I hear a lot is, historically, there have been some groups that have a lack of trust with the medical system because of like historical events. For example, in the Black community, people remember Tuskegee, which was in the late 1930s, early 1940s, where Black men were in an experiment kind of against their consent, right? So they thought they were receiving a treatment when they were not, and they were just following the course of their disease, even when treatments were available. So, anyone now would have said that is unethical. And also, members of the Black community were helping with the research too. So it just felt like a huge betrayal. And I think now people look at this vaccine rollout, and there's a lot of reports about minority communities needing to be vaccinated, and people wonder, is this an experiment against us, on us? Are we being tested? I want people to feel confident that the vaccine is not just focused on one community, and it's not trying to just, for example, focus on BIPOC people or people of color. If you look, it's going across the whole population, so everybody is receiving the vaccine, and although it is new, it's been studied and in the proper way. So that's how I feel comfortable. But I think we all have to remember that these historical things that have happened, that's part of why people may feel hesitant. And so when we talk to people who are hesitant, we might need to try to recognize where that person might be coming from.
Yeah, and it makes me think, Yolanda, we've got that terrible part of our history, and then we have another group of people who've been experimented on in the past, and those are people with intellectual disabilities, right? So I'm
Yeah,
thinking of some of the
absolutely.
hepatitis experiments that they did with people who lived in institutions and families signing to say, you know, I'm going to do this because I know they're going to get better care. And they were signing up for something that they also didn't realize what they were really signing up for. And choice and the freedom to make choices is so important to people who have not necessarily had that in the past. You know, so I think that sensitivity you talk about it is really important. But I guess part of what I think about is the importance of feeling like you've got all the information, right? So that you can make really an informed decision. And I worry for some people who may not have all the information, right? So they feel like it's their choice to make a decision, but they may not understand certain things. Now, I really want to make sure that people do understand the information that they have to make those kinds of, it's become kind of political, you know, I think it's overwhelming for everyone right now. Some people have asked, you know, why all the politics around this? We have the flu shot. People get the flu every year. No one tells me I have to get the flu shot. Why do I have to get the COVID shot? What do you say
Right.
to people when they ask that?
Well, you know, I think people think, oh, are we only emphasizing vaccines? But I think the season is for vaccines right now. And we do know that the vaccines are the most effective measure that we have for combating COVID-19 at this point. But it's not the only thing that we've been doing. Of course, we've been doing public health measures this whole time, but lockdown has serious side effects.
Yeah, especially for this
Right?
population, right?
Really serious problems with our mental health and well-being. And so we can't rely on only lockdowns to stay safe from COVID-19. And we are continuing other things like using masks and limiting the size of gatherings, especially indoors. But there's only so much we can do on the public health side. And then like using medications to treat COVID is, of course, being studied and followed. And there are quite a few drugs that were already in use that have been studied in fairly large studies that are being used now, for example, like steroids, like dexamethasone, or drugs that are new, like monoclonal antibodies that are being studied and used for COVID-19. So it's not that we're ignoring that side, but I have to say the drugs are not nearly as effective in preventing people from going to the ICU or preventing people from dying compared to the vaccine.
Yeah.
And that's why we're leaning on that side. And prevention is so much better. Nobody wants to go to the hospital. And most of the medications that we have right now, basically all of the medications that we have are for in-hospital use. We do have a few drugs coming down the line that might be used, you know, in the community before you ended up in hospital, but we're not there. And it's much better to not get ill in the first place.
Right. Well, let's talk about some of those things. Let's talk about, you know, as I said, most people, or the majority, more people have been vaccinated than have not been vaccinated. And that's across our country, although some provinces have higher vaccination rates than others, right? So people are wondering who have been vaccinated. You know, everyone's hearing about Delta and the cases going up again. We're seeing, you know, some really awful things happening in certain provinces right now, you know, like what we're hearing about in Saskatchewan and Alberta. You know, people are afraid, especially I think families who have a loved one with a developmental disability, someone with a disability themselves who hears about how, you know, how dangerous Delta is. If you've been vaccinated, you know, should you be afraid? What can you do? I think this is a big question that people have. So can we help people unpack all that information?
So I feel like you know the numbers better than I do, but
I do have some in front of me if you want to know.
I guess you want to talk numbers, but I do know that the vaccines have been really effective even for the Delta variant in preventing hospitalization, preventing serious illness. So that's excellent news. The Delta variant has been shown to be transmits more easily, and it has been shown to cause more severe disease. But if you've been vaccinated, you have protected yourself from the Delta variant. That being said, none of the vaccines are 100%. So you still have a chance of contracting COVID-19 or the Delta variant, for example. So being careful is not a bad thing. But I think at the beginning of the summer, when everyone was starting to get their vaccines, we were all excited and thinking that we would just go back to normal. And maybe we're not going to go all the way back to, regular life. But I think now we can start to weigh the risk and find safer situations for ourselves. So, for example, if you're going to be around people outside of your household, wearing a mask inside, if you're inside, or try to spend more of your time outdoors or in a well-ventilated area, like windows open, that sort of thing. We may not be in a situation where we're absolutely at zero risk, but if you're concerned because of other health issues or your own level of concern, then it's reasonable to continue with things like masking, limiting who you're going to be in contact with, that sort of thing.
Yeah, especially, again, it's one reason why we're being more careful with that is we're thinking about the people who haven't been vaccinated, or we don't know if they've been vaccinated. So we know that everyone under 12 hasn't been vaccinated, right?
Mm-hmm.
There might be people older than 12 also who haven't been vaccinated.
Yeah.
So we're thinking about ourselves, but we're also thinking about the people around us and trying to reduce just how many people have COVID.
Right, and avoiding that spread, because as a vaccinated person, you might be less likely to get very ill, but you might be spreading COVID-19 to other people who are not protected.
Yeah, so it's still sort of taking care of each other. I just want to go, we're talking about the numbers. I don't have the numbers for all of Canada, but I was just looking up information here for Ontario, and of all the people who've been diagnosed with COVID since January of 2021, the majority of them have not been vaccinated, or maybe have been partially. So this breakthrough sort of infection, when someone has had both vaccines and it's been at least 14 days since they had their second vaccine, they're considered fully vaccinated. And it says that about 5,900 people have been fully vaccinated who then were diagnosed with COVID-19. And of those, about 4,300 of them, as of the beginning of September, had some kind of symptom. Okay, so that's everybody in our province. It's not a huge number of people. And of those, people who are under 80, fewer than 20 of them have died in the whole province. So chances are there probably isn't a single person in those 20 who has a developmental disability. And about 20 people have been in the ICU under 80 in that situation. And we're talking about just over 100 people under 80 who've been hospitalized at all, who've had both of their vaccines since January. So it's a really small number of people at this point, which I take that, I take some comfort in that as a scientist. It means we can't study what's happening for breakthrough infections for people with developmental disabilities.
Yeah,
but that's because the numbers are too small. Like that's a good problem to have at this moment. And we will learn more over time, especially if we sort of compare our numbers with numbers around the world. But we don't have numbers yet on what's happening to people with developmental disabilities and breakthrough infections, which is because there aren't that many and there aren't enough for us to be able to study yet.
Yeah, it might end up being that we have to look at international data overall to get that information. Yeah, which is a good thing, right? It's a hopeful thing, because I think I feel like we were really, really hopeful when the vaccine came out, and then now Delta variant came out around, and everyone started to feel like, oh, starting all over again. But it's not really. That's not where we are. We're wiser. We know a lot of the things that we could do, and we also have the vaccine on our side. So we're in a better place.
Much better place. Yeah, and I think, you know, again, the same as you're saying how important it is if you're afraid of getting the vaccine to have that conversation with your doctor. I think having those conversations also thinking about, well, what's safe for me to do? What's safe for my loved one to do? Like I'd say book an appointment, have a conversation, figure some of these things out, right? Because we might say in the guidance, this is safe, or for most people, this is very safe, but what feels right for you, that's still your decision, right? And we have to
Yeah, and
respect
some people
different
were
people.
asking things like, can I go to my day program or activities that we used to do? And I think it's worth sort of looking at the risk profile of that activity and then having that conversation and deciding what you think. So maybe asking some of the questions. Are we screening people to see if they have signs of COVID-19 before they enter? Will we be mostly indoors and outdoors? What proportion of people are able to wear masks? That sort of thing, you know?
Yeah, and also how the vaccination policy of people who are coming into the program, windows, ventilation, you know, how many people are doing an activity together in the room? Is it always the same people? I mean, there's a lot of guidance. We've certainly seen this with our classrooms with schools, but we're going to see specific guidance as well for different kinds of day programs about how activities should run safely. But thinking about those things, seeing it for yourself. And I would say also kind of weighing out like, you know, sometimes you might say, well, that's a good activity and it's fun, but I could probably do this instead and it might make me feel a bit safer. So it's kind of weighing out like, are you happy doing the virtual activity instead? You know, how is your day? What is your day like if you opt to do this instead of to do that? Can you manage it as a family caregiver? How's that for you? As someone with a disability, how's that for you? You know, they're personal decisions also, I think.
And we were talking before about not throwing away everything that we've learned over COVID. So some people have found that certain virtual activities were really good for them, or that traveling really far to go to a program every day of the week was not good. And
Right.
now they might need to try and reimagine how they're going to go forward with things. And just like everyone's sort of reimagining how they're going to go back to the workplace, this is the same thing, right?
Right. Right. Thinking out which kinds of parts we keep and which parts we know have to change. And also the speed at which we do make changes as people are starting to go back to things. It's not easy to, even if you're returning to something that is good, right? That doesn't necessarily make it easy to return to it. I think there's still challenges. So I think we have to, again, have conversations, right? And sort of like, don't just go, like, go see how it's going, you know, problem solve, go back to the drawing table, work together, take time to make some of these changes.
Yeah, and have a conversation too with your loved one about what they like doing and how they feel about COVID. You know, we make a lot of assumptions sometimes, right? It's good to understand what risk level they're comfortable with too.
Yeah. And it can change, right? So sometimes someone might feel really, really anxious about something, and then a little while later they may not, or they might feel okay with it. Then they see something in the news and they don't feel okay again, you know? Speaking of news, this is something that came up from a few families, but I mean, I get overwhelmed. You know, I have this beautiful thing called a phone that tells me as soon as I look at it, all the news and all the stuff that's going on. And there are headlines, right? You take the TTC and you're standing and you're waiting for the subway in Toronto, and there's this big screen popping up headlines, and they're really upsetting. And I think that is really hard for people, for all of us, and for some people with developmental disabilities in particular, to be sort of overwhelmed and afraid from what they're seeing in the news right now, even if they've had their vaccine. So I don't know if you found anything helpful, Yolanda, in your practice, or if you have thoughts on that.
Yeah, I'm still a big proponent of limiting the amount of time you spend consuming COVID-19 information, which is hard because it comes in so many different platforms. It can even come in your regular social media and things that you might use for other reasons. But yeah, I think you have to have a limit to the amount of time you spend thinking about that. So, you know, making sure you structure your screen time carefully, and the time you spend consuming that information. You might say, actually, I'm not even going to listen to it for a while, or I'm going to give myself this much time. Put a limit on those news apps. Put a limit on different things like that in your phone. And then maybe having some conversations too, like talking about what you're hearing sometimes, right?
Yeah,
like if you just hear it and you keep it inside.
Yeah.
Yeah.
Because sometimes you think you understand a fact, and this could be both people with and without developmental disabilities, and then you talk about it and you realize you kind of got it a bit wrong, right? So having the conversation, and again, I would say, like, have the conversation with your doctor, right? If you're hearing information that's upsetting, that's scaring you, it might be helpful to remember a few simple ideas about COVID, about how it spreads, about what it means you've had a vaccine, what you can do safely. Have it visual, have it written, have it recorded when your doctor says it, and just go back to it, right? So some simple kind of reminders. But if you don't have those conversations, because it's all inside your head, right, and your heart, then people can't help you with it. So I think that's a really good point.
Yeah. I mean, and then all the things that we need to do to reduce anxiety in general.
Yeah.
We can't just sit in anxiety all the time. It's terrible for us, terrible. And we've done a lot of damage with these lockdowns and things like that, with a loss of activity, loss of physical activity. So we need to try to build that back in, finding things that we love to do, getting some movement back into our lives, eating well, all those things, like taking care of ourselves so that we don't have to just sit there and focus on the bad news.
Yeah. Yeah, no, it's a really good point. Thank you. I'm just peeking at my questions. One thing we were talking about, the other things we can do, it's not just the vaccine, right? One thing is masks. Masks have not gone away. I know in our province, we've kept masks as something that we wear when we're indoors. And sometimes when we're in crowded spaces outdoors as well, even if we've had our vaccine. Lots of questions. Do I have the right mask? How do I wear my mask? I'm tired of masks. You're a mask. You were showing off some of your masks before. Do you want to sort of give another sort of primer or reminder about mask stuff for us?
So then I started reading about masks and got really into it. So now I'm excited to tell you about masks. So last night I was started digging through my kids' masks to see if I did the right thing with all, because I didn't even know. Okay, so first of all, if you're using the cloth mask, you want to make sure if it's cotton that it's 2-ply with another layer in the middle. So the third layer, for example, in this mask here, we've got this white third layer that's interfacing, so that's acceptable. You can also have a filter, like those fancy kind of space age little cloth that can go in here, but it's disposable, so you can't wash it and use it again. You can use the interfacing over and over. Like I looked at this mask that my kids have been using, and it's only 2-ply, no interfacing. And I mean, I could do some modifications if I feel fancy and open this up, and then you can stick some interfacing inside, or a public health said you could, if you're on a budget or a time budget, you can take a paper towel and fold it and put it in there, or a coffee filter to put in there. But the best thing is just to get the 3-ply mask. And then they also have a medical style mask. But a lot of people have been asking, how come it says not for medical, like it's not medical grade? And I think there are certain rigors that need to be for sure done in order to be used in a medical setting. But many of the masks are adequate. So you just have to, they're safe to use. So you can try those ones too. It's about the number of layers,
right,
and the type of material.
So again, good question to bring back to your doctor if you want, right? There is lots of stuff on the internet, but sometimes it can get a bit confusing, right?
Right.
So,
yeah, and it's changed because, when we first started, they said, oh, just, I don't know, use a piece of cloth. You can use any cloth and put it over your face, and like a bandana or whatever. And now we've evolved and want to have something a little bit thicker, and they have certain types of materials that they're expecting. So just keep asking the questions to someone who's read about it.
Yeah. When we were talking about vaccines before and what's going to happen next, there are questions. We've started to hear more about boosters, right? And certainly in Ontario, we have announced and we've started to give sort of a third vaccine to certain groups of people. And people are asking, well, what about people with developmental disabilities? They're at greater risk if they get COVID of doing really poorly. Does that mean they should get the third vaccine sooner? Will they be getting it now? Should they get it now? What's going on with that? And there's not a lot of information out there yet. So I wondered if we could talk a bit about sort of unpacking what that might mean and what we might expect in the future.
Yeah, I don't know what we're going to do, to be honest, about the booster just yet. I know that we've started with people who are immunocompromised because we found that the vaccine hasn't been as effective for that group with the 2 doses. We don't know about really the effectiveness for people with intellectual disabilities specifically. So that's one thing. But I do think, I think it's reasonable to think that we're going to be doing boosters in the long run, probably for everyone, but just like before, where we're not going to do everyone all at once. But so far, that's not the case. And I think it's also an important kind of global decision, right? Because there are parts of the world that have not received their vaccine as of yet. And so it's difficult to say that we're going ahead with our third vaccine, boosters, et cetera, where some countries have not had it at all.
Yeah, I think that's a really important point, that the same as you want to take care. I get my vaccine and I still wear a mask right now during Delta because I'm also caring for people who haven't been vaccinated in my community, but we're a global community, and there are parts of the world where people might have to pay if they want to get the vaccine, or there just isn't enough vaccine to go around. And we are trying to figure out how we make sure we get everyone vaccinated. It's an important question. I guess I would add around the booster issue, one thing to keep in mind. So just because someone is at greater risk of getting COVID or of doing poorly if they have COVID, that's not the same as being immunocompromised. So people with developmental disabilities as a whole big group are not immunocompromised, right? Like there's a very specific smaller group of people who have real problems with their ability to have a strong immune response to the vaccine. And so far there isn't information telling us that is a much bigger issue for people with developmental disabilities. There have been questions about what it means for people with Down syndrome, because first of all, they are at higher risk, I think, if they get COVID. And there also are some issues for some of them in terms of how their immune systems respond. And could that be one of the reasons why they have a harder time if they get COVID? So I think we're still learning about that. There's no sort of information that's been shared in other parts of the world around Down syndrome and the booster, except to say that there are some parts of the world that are saying, I know in the UK, they've said that right now, actually, when we think about who should get a booster, prioritizing or recognizing some of the unique risks for people with Down syndrome, and also people with very severe or profound intellectual disabilities, that those might be groups who are really susceptible or vulnerable if they get sick, and there may be issues around their immunity to think about. But one other thing to consider is when people got their last vaccine. So if we're talking about Canada, keep in mind that some of our oldest adults who are living in long-term care settings, for example, they got their vaccines last December, January, both of them, right? So we're thinking about boosters for them faster than we're thinking about other people with developmental disabilities, most of whom did not get their second vaccine until, possibly June or July, right? So if we're looking and we're saying that, for 6 months, we're pretty comfortable with most people's immune response, we still have some time, I think. So we don't have to feel quite as worried, a month or 2 or even 3 after getting both vaccines for most people with developmental disabilities. So I think this issue of boosters is something to think about, and we'll be learning from other countries where people with developmental disabilities got vaccinated sooner than in Canada.
Yeah, that's the other thing, right? Yeah, because we weren't off the front. We weren't getting folks with intellectual disabilities prioritized. So we're not first. Yeah. Right.
Yeah, so we have time And we also have more, like you say, we have more evidence now than we had before about why it's important to think about this population. So I don't think anyone's going to forget, but it's going to take a little bit of time for us to figure out how these things work and who we need to prioritize the vaccine for.
Mm-hmm.
You have your questions. I have my questions. I just want to see, is there anything you think we've kind of missed or skipped that was really important to some families for us to talk about?
Oh, some people were asking about kind of combating boredom.
Right.
Because even though a lot of programs are starting to pivot and finding ways to reconvene, if we're looking across the country, not everyone has their day program or their usual activities available to them. So I think we've learned a lot, especially here in Ontario. We spent a long time in lockdown. What do you think about combating that boredom, that loneliness? What can we do?
Yeah, I mean, first of all, I'm going to say, you know, COVID kills, loneliness kills too. So there's actually been really important research on sort of the long-term effects of just being so isolated, you know, even from before COVID, for people with intellectual and developmental disabilities. It is really hard for some individuals and also really hard for some families, right? When there's really nothing going on. And some people, like you say, have really responded well to some of the virtual activities and the flexibility of some of those things that they can do, you know, but a lot of people have not, right? So I think the same as you can have that conversation with your doctor about, should I get vaccinated? How can I do it in a safe way? Or now that I'm vaccinated, what can I do? We need to have conversations about what I can do for my mental health and my activities right now. You know, I think that we need to be advocating, you know, as a system, the same as we push so hard for kids to get back to school this year, because we know how important that is for them to be in school in person. You know, we need to be advocating for making sure that everybody can have meaning in their lives day to day. You know, so if you're not able to go to work, but there are other activities and structures that were really important, we need to, on a big scale, make sure we're prioritizing that everyone has some kind of plan or something they can do. You know, I think it would be risky if we said, okay, everybody go back to doing exactly all the things that you were doing because everyone needs 7 hours a day. Like, we're not ready for that. Some of us don't want it. It might not be safe with everything that's going on with COVID. I think it's really important to have some meaning every day, you know, and it might be that walk or getting fresh air and going outside. It might be taking care of an animal. It might be helping to unpack the groceries, doing stuff in your room. You know, it might be with other people with a structured activity, but it might not be 6 hours.
Yeah.
You know, we might
And
have to
I'm thinking about, yeah, I'm just thinking about those families that don't have the adequate support. Like, they maybe used to have like a support worker that came every day, and now they're down to 2 days or something like that because of COVID and availability, safety. What have you heard from families? What do they do?
Yeah, I mean, I think again, and I would bring it back to your, I tell families, you know, in terms of advocacy, we do have in every province, there's sort of like an office or a place to go around developmental disability type services. But we know that there are wait lists. We know that sometimes it can be hard to find a worker. Not everyone can afford to pay for people privately to do activities. But I think if it's about your health, and this is about your health, you have the conversation again with your doctor and you figure out where is that system that's going to come in here to do something. And it may not be, again, the 6-hour activities all day, right? But something that can be done, additional help. And knowing, I think as families, knowing like, when are you at your limit, right? And being able to articulate really clearly, not being afraid to say, I am at my limit or I'm nearing my limit and I need someone to help me. Now, I might be scared if some people are coming in, I might be scared about the risks and what that means in terms of COVID. So again, that conversation with the doctor on how we weigh out those different kinds of risks is really important. You know, and thinking about what the activity needs to be, I think does vary again by individual and by family, right? So it may just be, you know, for one family, it might be if there's just a day where there's stuff going on and that's a day that's kind of a respite moment for the family. Or it needs to be an hour, but every day, right? So I think it kind of depends on people. And I think for sure, sometimes it's paid supports that we need. We're also part of communities. Sometimes there are people around us who would want to help, but they're not mind readers. You know,
Yeah,
so
and you
they're not
like
able to
you would have to
communicate.
reach out and say, we would love it if you could spend an hour and take a walk or whatnot. It would be so helpful, you know?
Yeah,
Yeah.
and it's hard to say that, right? I need help, but like just to say
Yeah.
this is what would be helpful, you know?
Or sometimes you don't, it's almost like you don't know, like everything's just happening so fast that you don't realize that you do need help. Like you think that you're managing okay, and then you realize that actually you're really burnt out and it's affecting your relationships in your household. And that's when you have to start figuring out what you're going to do. You know?
Yeah, but absolutely. I think boredom is not a small matter. And it is something we have to think about. But there's also a difference between, you know, it's kind of like keeping in mind that for some situations, absolutely more help needs to come in, more activities need to happen 100%. But also recognizing that something that would make me feel bored is different than what would make you feel bored. You know, it's hard sometimes for people, for all of us, and I think sometimes for people who can't communicate as easily, for them to express how distressed they are about their situation. So we have to kind of look to see how distressing it is. But sometimes, even though they may not be doing as much, it doesn't necessarily mean they're as distressed about it as you or I might be. So it's again finding what's the perfect fit for that individual right now, what is needed most. And what's needed most for you as a family member, which might not be the same thing as what your loved one needs. Having the conversation again, I think, with a healthcare provider around how to figure those things out and to be able to talk about it is really important. Thank you so much, Dr. Niel, for talking with us today and giving us your wisdom. And I'm sure we're going to ask you questions again.
Hey, no problem. I'm happy to do it.
Okay, take care.